Flu season is officially here. And as family and friends gather for the holidays, the risk of getting sick a little bit higher.
Joining us now with tips to stay healthy this time of the year, San Diego County Public Health Officer Dr. Seon T. I'm going to call you Dr. T.
That's fine.
With your permission. Good morning. Thank you for being here. We talk about this every single year, and I'm still, who in my family, somebody in my family I think just got the flu, and I said, did you get the flu shot? They're like, no, and they're really, really sick, and I'm like, I mean, it's a time of the year.
It is. Yeah, thank you for having me. And there's a lot of healthy choices that we can make, right? Like washing our hands, getting a good night's sleep. We were just talking about that, staying away from sick people. But the most important thing is exactly what you just said that we could do is get your flu shot. We know, especially when we're talking about missing days from school, missing days from work, and avoiding the hospital emergency department and death, vaccines are important.
Who in the family is more likely to get sick here?
Unfortunately, it's our tiniest members of the family as well as our oldest members of the family, but anyone in any age who have underlying medical conditions like diabetes, heart disease, asthma are also vulnerable.
This year, we were reporting that there's a variant with the flu. Is that true? What is that?
It is. It's called, there was a drift. So it was a slight change in one of the variants or one of the strains. And it is more severe, and we're seeing that in Europe, and that is circulating now in America as well.
When you say it's circulating at this point, what are we, like beginning of December? Is this peak of flu season, or we still have a ways to go?
We still have a ways to go.
Wow.
But we are seeing cases rise locally. We are seeing hospitalizations, over 150 already this season. We've seen 3 deaths already. So it is going to get worse.
You mentioned that, but is it too early to tell just how bad of a flu season we're going to have? Because sometimes they can predict it's not going to be as bad, it's going to be worse. Can you tell by now what you're going to be seeing in January, February?
It's impossible to predict right now, but we know that cases are rising. We have a new strain or variant. So the most important thing that we could do is to get vaccinated. We don't want it to be like last year. Last season, we had the worst season on recent history. Yeah. We had 7 kids in San Diego die from the flu.
From influenza.
Yeah. And many of them were healthy.
And many of them were healthy. For those who may be sick already right now, is it too late to get the flu shot, or do you have to wait until that sickness is over to do it?
Maybe. If it's a mild illness and you're on on the way to improving, then it's probably fine. But always talk to your pharmacist or doctor, and they should be able to advise you.
People always want to know, can you get sick from the flu shot? Because
everybody says that.
They get their flu shot, and then it's like, oh, what a coincidence. The day after, 2 days later, now you got a flu, now you got the cold, whatever. Hey, clear that up for people, because it seems like every time we talk about this, we have to explain what that is really.
And I get it, right? Like after the shot, sometimes you can get soreness, you can get a low temperature, you can get a headache, things like that. Yeah. So, but that's your body, that's your immune system working.
It's working.
Yeah, but so you cannot, it is not scientifically possible to get the flu from the flu vaccine. But it can be coincidence because flu is circulating. So you could have gotten exposed to the actual flu at a similar time and getting it from that.
Well, but if you do that, you get exposed to the flu and you've had the flu shot. This happened to our family, I think, last year. My husband didn't get it. Myself and the kids did. Flu came into our home. I was better in like 2 days, and he was out for 2 weeks. You know, so that really makes a difference about whether you have that flu shot, how fast you recover from it as well, correct?
Yeah, that is one of the most important things about the flu vaccine is that it prevents severe outcomes, right? It prevents those hospitalizations, the deaths, missing school and work and things like that impact our economy as well. Yeah. So, and it takes about 2 weeks, since you said 2 weeks, for the vaccine to work. So plan ahead and get it as soon as possible.
It's reminiscent of all our COVID conversations where it's like that wasn't going to prevent it, but if you do happen to get it, it'll be a lot smoother ride recovery than if you didn't have it. Does the county offer flu vaccines? Like, can we just go?
We do. For uninsured individuals, we can go to any of our public health centers. But either way, if you're insured or uninsured, you can go to myturn.ca.gov and you can find a place to get vaccinated.
All right, Dr. T, we appreciate your time. San Diego County Public Health Officer, happy holidays to you. Thanks for being here.
Happy holidays.